Unfasten all straps on the posterior side of the device. Bend the knee at a 90-degree angle with the foot flat on the floor and place the device on the leg, such that the patella is centered between the condyle pads. Align the center of the hinge slightly above the middle of the patella. The device is pre-assembled with medium condyle pads. There are also thin and thick condyle pads included with the device. Use any combination of the condyle pads to widen or narrow the width of the device at the knee. Realign the center of the hinge slightly above the middle of the patella. Fit the lower cruciate strap first, located directly below the knee. This strap is located above the calf muscle and aids in the correct positioning of the device, as it helps create the device-to-bone contact required to help keep the device in place. Adjust the strap length as needed. Next, snugly fasten the bottom strap by inserting it through the D-ring. To adjust the height of the frame, loosen the screws on both sides of the upper frame and pull the frame up with a steady force. Ensure both hinge arms are even. Retighten the screws until snug. Continue with the upper cruciate strap, located just above the knee, and then fasten the top strap. Over-tightening the top two straps can cause the device to migrate. Snugly fasten the anterior tibial strap and, if needed, adjust the tibial pad. If needed, trim the tibial strap. Conduct a final brace check and adjust as needed. D-rings can be moved from the interior to the exterior or replaced if broken. Bend the D-ring mounted on the device's interior, push it inwards and remove it from the rivet. Attach the D-ring on the exterior by pushing down onto the rivet through the keyhole lock. Slide and click it into place. Place with indented side facing up. If needed, repeat the steps for the other D-rings.